Welcome to Medically Speaking. Our guest today is Dr. Danielle Doria, a board-certified plastic surgeon here at Buffalo General Medical Center. Doc, thanks for joining us.
Thank you. It's great to be here.
So let's start with overall, when a patient may hear the need for reconstruction, I think people, for the most part, understand chemotherapy and radiation, but when they hear reconstruction, maybe if you can give us a overall sense of what is reconstruction and why would patients, female or male, need that?
Reconstruction is the process of trying to give the patient a normal appearance after they've had a mastectomy or a lumpectomy for breast cancer. And it's really a highly personal journey and a highly personal choice whether or not to even undergo reconstruction. Some patients opt not to have reconstruction, and that's fine. And they can still come to me and we can have a discussion about what that looks like if they opt out of surgery. And that can be a referral to a breast cancer specialty bra shop where they can get prostheses and special bras and special swimsuits and clothing that should be covered by their insurance, or the option to just do nothing at all. But a lot of patients want to look and feel like themselves again after having gone through breast cancer. And so we can also offer them a reconstruction as well. And that can vary between simply doing a breast reduction type of surgery if they simply need a lumpectomy, and we can kind of rearrange the breast tissue around their scar tissue, or the lumpectomy if it's done at the same time as their breast cancer surgery, so that it looks good afterwards. Or they sometimes come to me many months or many years down the road, and we can still offer reconstruction at that point as well. Sometimes we're talking about putting tissue expanders in to kind of stretch the skin, sometimes implants, sometimes using their own tissue to do the reconstruction.
Yeah, we'll get into some of that stuff in a little bit. Let's go back, if you will, for those who, we assume people know these things, but the difference between the lumpectomy and a mastectomy for a patient who may have a breast cancer diagnosis.
Right. So that's something that's decided upon between the patient and the breast cancer surgeon. And so usually when they come to me, they've decided along with their surgeon, what's the best option for them? Is it just to do a lumpectomy, which means taking out basically a lump of breast tissue with the cancer, or is a better option for them to do a complete mastectomy where the entire breast is being removed? And it really depends on what type of breast cancer they have, what kinds of risk factors they have, and what kinds of tissue margins the breast surgeon needs.
So, when you hear lumpectomy and mastectomy, they're scary, phrases or terms for people. How common is this for breast cancer patients in terms of having to deal with one or the other?
Right. So unfortunately, it's common, and unfortunately, it is becoming more and more common, and we're seeing patients at younger ages as well. So it's not something that only happens for an elderly patient. It can happen anywhere from a patient's early 20s all the way up until 80s or 90s. So we're seeing really a wide range of patients these days, and most people are going to want to have at least the discussion behind what options they have as far as reconstruction and returning to a more normal appearance.
So in saying that, in a journey to get towards a more normal appearance, so say they have a mastectomy or a double mastectomy. You mentioned expanders before. If you can talk us through what that process looks like, and what you have to do as the surgeon.
Sure. So if somebody is going to have a mastectomy or a double mastectomy, meaning both breasts removed, and we decide to do a reconstruction, then there's kind of two options at that point. And again, it really depends on the patient and their risk factors and their anatomy. But there's the option to either put a breast implant in immediately at the time of mastectomy, or sometimes we need to put in what's called the tissue expander. And what that is it's an implant, if you will, that comes flat, and then we slowly expand it over time, over weeks to a couple months in the office. and slowly stretch the tissue to try to either get to a bigger size or to try to preserve as much tissue as possible without damaging the blood flow to the skin.
So in that scenario, getting the expanders first and then eventually the implants, that would require multiple surgeries. But if you can explain how that will help the patient return to a more normal look and feel for themselves.
Sure. So, like I said, we would try to always put an implant in right away if we can, but sometimes that's a little bit more risky. So, sometimes putting the expander in first is just a safer way to do things with less risk of complications. And so, immediately after surgery, their breasts are still flat. After the mastectomy. But then, pretty quickly within the first few weeks, we're able to start putting some saline, some salt water into those expanders and slowly inflating them up. That also gives the patient some control over what size their final appearance is going to be. Do they want to be smaller or larger than they previously were? And it also gives the tissue some time to recover so that we have good blood flow to the tissue. We can also then kind of fine tune things at the second stage. Maybe one side's a little bit higher, a little bit lower than the other, and we can do a little bit of fine tuning that way as well.
How long is a recovery process, or what does the healing journey look like for the patients?
So it depends on what the first part of the surgery is. So if it's a lumpectomy, usually just a couple of weeks. If it's a full mastectomy, whether or not they're doing reconstruction, the recovery is still 4 to 6 weeks for most people. And then if they have to have radiation or chemotherapy, certainly that would extend that time period as well. So again, it really can vary from just a couple of weeks to many, many months, depending on what else needs to be done.
You mentioned earlier, the ability to have, specialty bra or, say swimsuits that the patient can acquire. In your time as a surgeon, how has that evolved and why is that important, when you point something like that out?
Historically, we didn't have any of that available for patients. So even if we did a reconstruction and the reconstructed breast isn't quite the same as a normal breast, so normal bras might not fit properly. Patients might still feel like they can't go swimming or they can't wear a tank top. And so the evolution of these newer bras and clothing for patients with breast cancer is really, really critical in helping them live a normal life afterwards. So they can go swimming and they can wear tank tops in the summer and really live a normal life to the point that many people might not even know that they had breast cancer or breast reconstruction.
So on that theme, you're a board certified plastic surgeon. You've been in the operating room and spent thousands and thousands of hours there. You've seen this, treatment evolve over the years. As a surgeon, when you're dealing with patients, obviously everybody's episode is personal and it's devastating. But, with the advances that you have seen, has that changed your outlook and has it changed how you communicate with patients? And, where do you see all this going, down the road?
Right. So it really has changed quite a bit. Even when I started training 20 years ago, patients were spending a week or more in the hospital just recovering from these procedures. Now, oftentimes they're going home the same day. And the actual surgical techniques have evolved as well. So there is less downtime, there's less recovery, and patients can start getting back to their normal life more quickly. The outcomes have gotten much better with the chemotherapy, and those drugs are constantly evolving, and the radiation techniques, and there's constantly new techniques that are evolving all the time. And so where traditionally, this could have been, for many people, the end of their lives, or at least living a normal life. Now it's not that. Now it's just, we tell people this is just a step in your life. This is just a road bump, and, you're going to get past this and you're going to be able to move on and do the things that you enjoyed in the past. This isn't going to stop that.
So great to hear. Last question for you. As I said, it's not October, it's not Breast Cancer Awareness Month, but, as a surgeon who deals with this, what's your message for people who are watching out there from a prevention standpoint?
Really, just what we've always taught women, doing a breast exam on yourself once a month, making sure that if you notice anything that's abnormal, that you do bring it up to your gynecologist or your primary care physician, and don't wait to have these things evaluated. The recommendations for mammogram is that it starts at age 40. That's still the current recommendation. And at some point, hopefully we'll have something even better than that, but that's what we have right now to try to detect these cases and detect them early, is doing a mammogram every year.
Well, that's great advice from one of Buffalo's best surgeons, Dr. Danielle Doria at Buffalo General Medical Center. Doc, thanks for joining us again today.
Thank you so much.